Good. My name is Lisa Dennis, and I'm an EBSCO training specialist. And pleased to be providing an ongoing webinar series for the Nevada State Library and Archives. Today, talking about health resources. So we have PowerPoints to go through, and then we're going to jump right into the interface. There are two specific health source databases to which your state subscribes. One is called Health Source Consumer Edition, and the other is called Health Source Academic Edition. So we're going to talk about both of those. We're going to look at the difference in the content. We're going to discuss search strategies. If you're not already familiar with the folders and the alerts, we're going to talk a little bit about that. And technical support is always available. I'm going to show you where with interface you can navigate our help center and tap into all of the help sheets and resources there. But you can always link to our support site, and that's found on the bottom of every single page, a link to that. So I'm going to make sure and point those out. We're going to show you how you can get the word out to your respective, when I say your customers, they might be patrons in a lot. If you're in a public library, they might be academic students. If you're in an academic institution or even in a school, they'll have different grade levels of school. You'll have teachers, you'll have different support staff, and you'll have parents. So there's lots of ways you can get this word out. And remember, every Nevadan has access to these resources through the state library. Then, of course, you can always register for more training sessions. And you can communicate with me throughout this session. Those on the live session, that you can communicate with me by sending me a chat message if you have a question, and then I'll stop and read it back. Additional training. Every month, we've designated the second Thursday of each month at 10 a.m. for EBSCO training, the Nevada State Library and Archives. So next month, we're talking about business resources, and then you can see rounding up the end of summer academic resources and public library resources. We're going to be running these until the end of the year, so hopefully you'll be able to join us for additional training sessions. And as I mentioned, those helpful links, it's a really easy URL to remember, fort.ebsco.com, and be able to find just lots and lots of information there. And then you can actually, like I said, sign up for that additional training exclusively for Nevada State Library. Any of this information down, I'll show you where you can find it within the Help Center. After today's, I don't mind completing a quick evaluation, then appreciative. Oh, that's wonderful, Sylvia. I'm reading, for those of you who are going to be listening to this on a recording, Sylvia's just sent a message that she works with seniors and homebound services in the outreach department of the Clark County Library District there in Las Vegas. So wonderful. I'll be up there in a few weeks for ALA, so who knows, maybe I'll run into you at the EBSCO booth, or actually as a trainer, I'm going to be attending a lot of the sessions in LA. So hopefully I'll get to see you there, Sylvia. So thanks for joining us. And what's great about what Sylvia just mentioned about working with homebound services, remember that all of your EBSCO resources are accessible remotely. Your patrons and your students, etc., do not have to come into the library. They can access these resources from home computer or anywhere, as they have internet access and a link to your library page, and then all they'll need is their library card or whatever authentication method you designated at your particular branch, whether it's user ID and password, but in most libraries, most public libraries, it's a library card. So without any further ado, we're going to get started. Just make sure I've got all my little ducks in a row before we up the interface page, and it should automatically drawn to library page. So as I shop out, don't for page may say in and out for just a minute. You might see a blank screen. And you're looking at my, and notice at the top of your screen, there's a green bar or a green tab that says Viewing Lisa Dennis's Desktop. Just remember, you can hover your mouse over that green tab, Sylvia, and you can click on the little chat icon, and that's how you can find that little chat box, so you can send me any questions that you have. Okay. Let's get started. Looking at the Nevada Library and Archives webpage, there's a number of databases from which you use. The nice thing about having the interface set up like this is that your users can scroll down and select which databases they'd like to choose. So you can actually search multiple databases, any combination, in addition to searching a single search, just searching a single database. That was a twister. So let's look at these databases, and I'm going to put them up here at the top of the screen so they'll be easier to view. Here are databases that we're talking about today. Talking about Consumer Edition and Nursing and Academic Edition. So you'll read the differences. Health has 80 consumer health magazines, but notice that this content is generally written, so it's going to be in easier terms. It's going to be in terms that you and I can understand. Health Source Nursing Edition, look at this, 550 scholarly peer-reviewed journals in text. So that is definitely going to provide more information for. Now that doesn't, just because it says Nursing Allied Health or Nursing Academic Edition doesn't mean that your library patrons can't search this. What it does mean, however, though, that it's probably going to be in nature in terms of the possibility of the verbiage. You know, in a nursing database, where you'll know the terminology is going to be based, and it's going to be based on particular illnesses, conditions, etc. So it's going to be Indian for somebody like me. I would have to really focus on the articles to make sure that I understand them. Okay. Now that's not to say that it's not a valid resource for your library patrons. You know, one thing that I've learned just being this earth for 50 plus years is, you know, I've seen family members, I've seen some close friends, I've seen some go through some issues, and you have to be your own advocate, and that's my opinion. I think that when you set foot in a hospital, you need somebody there that's with you, that can be your advocate, that can help just the information that the doctors and the clinicians and the nurses are talking about, and as much as possible, you're your own advocate. So I think it's great that the Nevada Library is offering this academic base to the public. You can actually read up on more and more. So this is great. Sylvia also writes, Mindbound patrons request books on their medical issues on a regular basis. Actually, the seniors. So perfect. So you know what? They have both these resources. Okay. So now that we know really the difference, we can actually both of them at the same time. We don't have to search one or the other. And I'm going to show you'll be able to differentiate which come from which resources. We're going to tick both of these boxes off and click Continue. notice that we're at the landing page. The landing page that the state library has set up. County can, I'm sure I've done some training there. It's been several years that I've been to the public library, but you can set up your pages the way you want. So if you want the home page to look a little bit different, you can have it with a basic search box or the advanced search box as they show here. If you choose the basic search box, you could actually continue to display these search options here, or you could hide them and have a nice clean space. So there are lots of options that you can do. With the state library site, this is the options that they have chosen or they have selected, but of course you can always customize that to fit the needs of your own patrons. So what I like about the advanced search page is that it provides the user with ways to search without the user having to really understand Boolean operators. The Boolean operators are listed right here, and search are listed right here. So in addition to just using a keyword search, and we're going to demonstrate a couple of methods, you actually utilize your Boolean operators and your field codes. You can here and say you want to limit it to full text. You can expand your search. You search just for scholarly peer-reviewed journals. You search for something that's a cover story. If you know a publication name, you can search within that. There's all kinds of things that you can do to really narrow search down. So now that I've just all over this page, I'm going to show you some of those. So we're going to start out with a very basic search. And remember, I can conduct a basic search here on this advanced search page. So search for heart attack. Okay? Some general keyword search on heart attack. Any of this to designate it as a subject term, I'm just going to do a keyword search. Go ahead and put my full text limiter on, and maybe I am interested in only articles about heart attack that have been found in a scholarly peer-reviewed journal. I have 4,700, almost 4,800 full text articles. Keyword search over here. So what I want to point out about this box right here, where it search, this is all a bread box. So every limiter, filter, expander, everything that we're going to put on this search is going up here in this box. Okay? So on the title of an article, I'll be put with my detailed record. I've got my tool on the right-hand side, and we'll talk about that in a little bit. And I've got a little text over here on the left-hand side. I can get this full text right here. This is part letter. Was just last month, May 2014. You can see over here, I can also view every other article in this heart letter. So, and here's the table that EBSCO provides. And of course, here we're on the front page, so we can actually see what's inside. So what's sick sinus syndrome? What are high fiber diets may stave heart disease. So, this is a wonderful article for me to read. If I don't have time to read it right now, of course, I can print it out. Use tools in Adobe Reader. I could email it to myself. I could add it to a folder. I could cite the article. I could to the article article, but you know what? I'm gonna put this in my folder. I'm actually, be more healthy conscious. Sister that's got heart disease, and it's really been an eye-opening experience for me. And I don't have heart disease yet, but you know what? If I can eat some of these things that are going to help me, then I am all willing and ready and able to do that. So I'll put this in my folder, and again, we'll come back and talk a little bit more about the folder later. But this article that I was looking at, an article about heart attacks. So if I've navigated away from my article, I can do is come back up here to the top left-hand corner. I can get back to my result list. I can refine search, or even download this PDF right here if I didn't want to put it in my folder. I could download this and put it on a hard drive on my own machine. But result list, and now I'll go back to that article for attacks. So now this is what I'm going to do. I'm going to do something a little bit different. And I'm going to scroll down, and then what we call these facets. And clusters, some people call them clusters, are ways to narrow your search down further, particularly when you start it with a keyword. So we just used the keyword heart attack, and you can see we've got 400 full text articles. But if I wanted to narrow it down by a particular source, so what am I really interested in about heart attacks? Is it that clinical myocardial infarction, or treatment? Or, I'm really worried about this. I want to prevent heart disease. So I'm going to click on prevention, and I see that there's 218 articles. So I've put limits on my goals or my search. I see your message there, Sylvia. That's wonderful. You can print articles for your homebound patrons. You can also email the articles to them. If they have an email address and you see this, you're helping them do some research, and you see this article here and you think this is great, it's a PDF. You don't need to print it off if you don't want to. Unless you're going to go actually visit them. But you want to get them that information as quickly as possible, just over here under your tools and click email. And I this to my husband. He hasn't had a heart attack yet, but I'm always, the worry wife, making sure. But my sister, I've got her sister who has had several heart attacks. So I could actually type this, and send this to her. So send this to any email address I want, and they're going to receive this PDF in its full text. They can either on their computer or then it out themselves. So this to me, and now I've got an email confirmation that I've received this article. Five things to do after you've had a heart attack. Again, I can click on it, and it is the PDF. So just send electronically to them. Okay. So facets help narrow down the result. And also, what I'd like to point out is narrowing down by the publication. If you or your patrons are sure of some of the quality journals and publications that are found in these sources, browse the publication listing. You see this Harvard Heart Letter. It's like a pretty cool thing that you want to set up. You can receive the journal about every month to your desktop. So I'll show you how you can do that. So you can through and you can see, oh wow, I didn't know that EBSCO had access to the Lancet. You know, we read about the Lancet all the time. Anything CNN or, you know, the news, the night news comes on, I'll say, oh, the medical journal Lancet, da-da-da-da-da. Well, how do you know that you've got the Lancet at your fingertips? So you want to set a journal alert up, Lancet. So journal alerts are conducted in conjunction with a folder. So we're going to go back now and we're going to talk a little bit about the folder. So the folder is every single one of the NIMs that have access to these resources. They can create their own My Host account, which is called, okay, I should say the My EBSCO host folder. Because you can have a session folder, which is just kind of like a shopping cart. Right now, and I emailed this to myself, I'm going to go ahead and put it in my folder. And, you know, heart attack and stroke risk with a flu shot. Well, that's interesting. I get a flu shot every year. So after a heart attack. So I'm going to put all these articles in my temporary folder. Okay. Now I can also open up, and there's folder feature I show to you in these tools. That. And I'll hover my mouse and the article. There's add to folder icon. So 3 ways that you can add a folder to a folder. Sorry about that. A good one. Too much sitting linked to heart attacks. So I don't have time to read these articles right now. So I'm just going to collect them, and then I can go back and read them when I have time. So that's one of the great things about a folder. Now, at this point, I put lots of things into my temporary folder or my session folder, and I haven't really done anything with them. So here on the right-hand side, you can see my folder view, and that and see that sets into my temporary folder or my session folder. At this point, I could save or export all 7 of these articles at one time, and this be done. And at that, I can go about my business. I can close out of this session, and I'll never see these articles again, except that they'll be in my email or print. But if I want to store them, because I use them for some research, or I just hang on to them because I don't have time to eat myself right now, or, you know, my email is down, or I can't get to my email and I don't want to print them up, I put them in my folder and save them. So on my EBSCO house, my host, sorry, and it's the question that you have. All types of exercising is another topic that comes up. Is there workouts on this site? We'll look, okay? We'll look at this. There might be articles that talk about specific exercises that can be done to strengthen your heart or strengthen your body. So that can be a search that we'll look at in just a moment. So now I'm going to go in and I'm going to sign into my EBSCO host account. And I can't believe I didn't do this the last time that I did my training for Nevada State Library, but I'm going to another account right here. I thought I'd created one, but I can't my login information. So I'm going to show you how easy it is to create an account. And you can enter on the EBSCO page, and you're going to see a link to our support site, to phone number, email, and you can scroll through the table of contents, and here is a help topic about personal account. Step instructions, including screenshots. I'm going to go ahead and do that right now. See if it comes up actually. Oh. Here's my account. So I create an account. That's how easy it was. 7 art I had. And my host account or folder, kind of like an email account. Get all these articles in. It's kind of like email. Well, I don't want to keep them in just my articles folder because I'll get too many things. So I get custom folders. Now I'm going to create a custom folder about heart attacks or heart attack info. Put all those articles in the attack info folder. So now you'll be able to come here and find every one of them. Okay? It's a new search. So let's conduct a search. And instead of just doing a keyword search like we did before, let's search for, like you said, exercise, and we'll subject heading and do and weight loss. And subject headings on these. So we're looking for articles that specifically talk about exercise. And while they may not actually give us some words, we'll find out. We'll see what we can. I'll look for full text because remember, if you're user homebound, then they're going to find the full text right there at their desktop and run our search. And got 1,100 articles and browse subject headings. And you'll see, click, I'll see my in alpha order, so aerobic exercises. So I could scroll down and say, oh, look, exercise for men, exercise psychology, exercise therapy. Go down here and see, I'm not sure there'll be a W for workout, but look, weightlifting, walking. Here's articles about different, these 750 articles on exercise. Well, get a flat belly fast lane. Wow. Okay. Look at this exercise. Click abdominal method. It comes out of the publication Prevention. And it's up. Plan. Forget crunches. It says 8 in tone midsection. You need a 3-pronged approach. Toning and lookout plan right here. Cardio, total toning, ab firming, Pilates. Pace for us 5 intervals for 20 minutes. And here it is. So look how easy that is. what a great thing. You know what? I'm going to put this in my folder. Now I've logged into my folder, and it's automatically going to go into my permanent folder. Go up here to my folder. I can create a new link size. Whoops. Let me put that article in my folder. Now, what you're asking about changing the font on the web page, that you can't change the font of the EBSCO web page, but what you can do is, if you don't know this trick, let me show you my menu bar. If most people are going to be using this through Internet Explorer, Firefox, etc., just about every single page or browser, I've never not seen this. You're going to view button up here. So when you click on view, look, say zoom in or out or size. So what happens if I click this? Okay, then it's going to make the screen larger, as well as I zoom this. So just make sure, teach your patrons how to use the zoom feature and the text size feature, okay? And now they'll scroll more, okay? They'll have to scroll more because it won't all fit on a page, but that's a great tip for your patrons. And also, something else to think about for just you on the PDF, we have the onto view whole publication. Look what you get with an HTML. Now, you're not going to have this with every article. So if you're looking at a PDF article, you're not going to be able to see this. But the HTML article's got a couple of really cool features. First of all, you can translate the article into 1 or 2 different languages. Okay. You could translate this into French if I'm a French-speaking patron. Now, Interface, all the navigational tips and tricks are going to say remain English. But if we just a second, my all itself that we're talking about is, okay, article in French. And okay, if you've got some non-English speaking patrons, that's wonderful. But just remember, it's only available in HTML. Unfortunately, we don't possess the technology to translate a PDF right now. But I'm faith that that's not too far in the future that we'll be able to do that. But right now, it's just HTML. And something else that might be really cool for any of your patrons that can't read the screen very well, they can take article into, first of all, they can have it audibly read back to them. You can have this article narrated back to them, accents, and load it, and so put it on their iPod, put it on, some sort of audio device that they can take with them. Yeah, this isn't an audio book, so just to be clear, they're not an audio book, but they could create an MP3 file so they could listen to this, through an audio. It's not designated as an it's not designated as an ebook, but you can turn it into somewhat of an ebook. But it is voice. I mean, is computer generated. Okay? So, but it still is a great option for somebody who maybe can't read what's on the screen. If they have it read back to them, all they need to do is play. For your visually impaired patrons, all you have to do is just, if they don't put text, if they don't put the mouse anywhere, it's going to automatically start reading from the title. But you just wanted to read a text, just select that portion of text, and then click on the forward arrow to start the recording, and it will, or not the recording, but start the narration, and it'll automatically just read what's highlighted. So it's a wonderful tool for anybody who's sight or vision impaired. Okay, so it's a great tool. So let's talk a little bit more about these folders and things you can do. Especially for your homebound patrons, they can get into the library to look at some of these journals, like the Lancet or Harvard Business Letter or RN, or I even saw the magazine Shape. Okay, so what if I wanted to search for a publication? Okay, hover over the publications link, the tool, and if I'm looking for Shape, that's a consumer publication. So I'll click the consumer database and my cursor down to the lower search box. Type in, Shape. Search for periodicals by subject and description, or I can match any words. And icon Shape, and here we go. The exact is Shape. We have full text back to 2002. And if I want to read this article every month and I don't want to go buy it, a newspaper, I don't want to go buy it at the grocery store, I can create a journal alert. Journal alerts are very easy to create. I click on title, and if I didn't want to create a journal alert right here, I can then browse every issue. Okay, so if I wanted to look at a particular issue, or I'd search within the publication and say, I want to look in the Shape about, okay, I want to search for a workout for my butt. So I can see 153 articles. The best for your body, 3 weeks sexier butt, the skinny jeans workout, That's kind of funny, the TNA plan. But you know what? It's a consumer publication, and it's going to, give you some great articles, show, give you descriptions on how to, get rear that you want. So at the very least, when you go to the publication, you search within a publication for a word. Or I could decide that I want to set up a journal alert. I go back to that publication, then Shape, Shape, and I'm going to browse. And here, keep on the wrong link. And I noticed that we don't have any 24 issues here, and that may just be because our editorial department is behind. So you know what? If you ever see that, and occasionally it does happen, it's pretty rare, but if you ever see something like that, if you see that this publication is supposed to be published monthly and you see any 2014 issues, do a favor, take just a moment of time and notice to that, then it'll go directly to our editorial department, and they will get publications in. So I'm going to show you how we're going to do that. First and foremost, before we move on, I'll come back to this journal alert, but I'm going to go right here to the support site. And here, support. You'll see it up here on the home page. I'm going to click it, and you know what's cool about this? When I navigate through, come to this link from your website, it typically puts your customer name in. So I'm going to go ahead and I'm just going to fill this out. I'm going to put service, put health, let's see if it does a source, consumer, let's see. You know what I'll do? I'll just say research databases. And I'm going to, under category, database products and content. The abstract is here at Health Consumer Edition. And I'm just going to put content for my name, and I'm going to put all right, now even put the no content So I'm going to send an email, and then I'll usually receive. Well, you will receive if you do this. Then I'll receive, and anybody that uses this format will receive an automatic email that says we have received your note, and they'll issue you a case number. Okay, and then I bet that within 24 to 48 hours, I'm going to get an email that says, "Hey, all the issues into consumer health for consumer source health source consumer edition." Boy, a tongue twister for me. And then it'll be loaded up. Okay. So every now and then, if you see something that says that the information is supposed to be there, and it's not, by all means let us know, and we will get it corrected. Okay? We've got a massive editorial department, and for some reason, who knows, maybe with a shapes list, and they're not automatically sending us the content. So we need to look into that. So please help us, and I appreciate you take the time to show you how to do that, because it's really important. It's important that when we get some great information, we get feedback, we get lots of suggestions how to better our website through you, our customer. Okay. So while we're on here, I'm just going to go ahead and take advantage of the fact that we're already on the support site. So I point out on the support site, we've got additional support centers for specific resources. We've got linked right here, so you can go and look at all the tutorials that EBSCO offers. Then we were talking about promotion. So we've got this fabulous page called Promotion Tools. And we'll click on it, find link a number of the popular topics, and if you see the days or resource that you're looking for, just come and click on Browse All Sources. Health Business Databases, Health Library, Health Source Databases. Here we go. So Health Source Consumer Edition, look at this. We've got bookmarks and buttons and posters and more on nursing and academic. So these are resources that are valuable not only to your homebound patrons, but to your patrons that come into your library. They know that you've got verifiable, academic, scholarly, peer-reviewed, vetted articles on various health issues. They don't want to go, not knocking WebMD, but, they don't want to go to the open web and find some forum where a lot of people have talked about, they've dealt with their plantar fasciitis, and find articles that have been written by clinicians and doctors and nurses, etc. So use this promotional resources that are found on our support page to help get that word out. Okay. So back to our publications. Just want to make sure any other messages. The YouTube link. No, the YouTube link is a tutorial on, it's just a tutorial on how to use EBSCO host resources. Now, there is other database. Unfortunately, it's not one that the Novate Library subscribes to, but called Consumer Health Complete, and we do have in that database that doctors are talking about specific illnesses, conditions, etc. That's something that you think that your library might be interested in, just send me an email after this session, Sylvia, and I can send you the information of who you'd need to talk to at EBSCO about that. It might be something that Clark County would be interested in purchasing or subscribing to, or even looking at. You could certainly set up a free tool to Consumer Health Complete, but that resource has a lot of great videos that doctors and clinicians have talked about. Okay, so just let me know after the session. So if I get a journal alert, and unfortunately we don't have time to do that right now, but I just go to the Help Center and I just look through topics and set up a journal alert. Think about all those medical topics that found in a publication like RN or Shape or any of the other consumer-related type magazines. And then you've got some friends that really know their stuff. Maybe they're a retired doctor or a retired clinician. The nursing and academic data. And if you search the publications here, I can search by subject and description. I can search for diabetes. They may want to find out more information on diabetes. And I see if we've got any full text. Looks like we have here in Nursing and Allied Health or the Nursing and Academic, or all of these are bibliographic publications. But let's go back. I could match words, or I could search again for or to use would be pediatric and I find some academic publications, children and young people, geriatrics, aging, nursing, older people. Use publications in order to find articles, but to find actual journals and publications that might be of interest to your patrons. Also use the subject headings. Subject headings are great when you're looking for a clinical term that you don't really know what it is. So in this case, I'm looking in the Nursing and Allied Health data, and I'm going to type in horrible four-letter word, cancer. And when I scroll through and I see cancer, I can click on these words, these hyperlinks, cancer, and then it's going to give me different, more clinical terms: tumors, blastomas, carcinoma, cancer, leukemia, meloblastoma, melanoma, carcinoma. So these are more clinical terms. Memory, again, you know what? You can aging here and find, let's see, say what other search terms might be used searching for aging: developmental biology, longevity, aging, for aging. So think about utilizing and letting your patrons know about some of these different subject headings that might actually be relevant articles in an academic journal, because these are some of the terms that they're using in applications. Okay, so does that make sense? Like geriatric, studying and teaching. Even up here, fat aging quiz. Well, who? Health, behavior, age factors. There's just so much that's available. And, in my mind, the more I can use something like this, the sharper I can keep my mind, because even though I'm in my 50s, and I say I'm on the younger end of my 50s, aging and memory is, when I can remember it, when I think about it, aging and memory is something that's always on my mind. I'm fully aware of things like, Alzheimer's and dementia, and I actually have a 15-year-old golden retriever who I think is, I think he is in the beginning stages of some type of, because he just gets confused a lot, and sometimes that happens, but the more about it, the more I'm aware about it, the more I can, there's some things that I can do. So and we just about out of time, so I am going to discontinue sharing the desk right now, and I'd just like to check and see if anything that I didn't cover that you want to know, or something that you wanted to see out of this session that you didn't. Okay, wonderful. Well, I hope that you will recommend this webinar to others. I'll send this to Robbie DeBuff at the State Library after the session, and honestly, I'm not quite sure where she'll post it, but I think she's gathering all of those, and she's posting all of these recorded webinars. And by all means, Clark County is a huge library district, and I'm in San Diego, so Las Vegas is not that far away. If I can get past all the traffic on the 215, then I'm pretty smooth driving up to Vegas. So if there's any, please pass this on to your Clark County librarians. If there's any time that you would like me to come up and do on-site training, or if you'd like to set up some webinars specifically for Clark County, please let me know and we can do that. We can set up some webinars specifically for your library system. So I want to thank you so much, Sylvia, for joining me on the call today. And you had a lot of great questions. You were very interactive, and I appreciate that. So if you do have just a few moments to complete that evaluation after you log off, that would be fabulous. And thank you so much. Don't forget to unplug your headset after you log out, and then you can log out by clicking on the X in the right-hand corner of your screen. I hope you have a wonderful day and an awesome weekend. Thanks, Sylvia. Bye-bye.